Hello and welcome to session 4 of our newly diagnosed webinar series. In this session, we will be discussing surgical and non-surgical management options for IBD. We'll be talking about surgical interventions, we'll be talking about pain management, we'll be talking about non-drug approaches to pain management, and we'll be talking about emerging therapies. So just to situate ourselves as to where we are with the disease management options we have available. So we are looking at only the surgical and non-surgical options. There are other webinar series that look at medications and diet. For Canadian IBD patients, surgery is becoming less common than it once was. That's because our medications are better targeted at managing that inflammation and allowing that bowel to heal. However, surgery is still a management option that is needed. So for Crohn's disease patients, less than half of them will require surgery at some point in time, and they may need surgery again due to those complications. So the complications that we talked about are the bowel blockages or obstructions, our fistulas, so the abnormal tunneling, and the abscesses, so those pockets of infection. And those complications are more common in individuals who have Crohn's disease than ulcerative colitis. And that's just because the Crohn's disease goes through all layers of the bowel wall, whereas with ulcerative colitis, it's only the inflammation is limited to the innermost layers of the bowel wall. So that's why you'll see surgical interventions are certainly less common in ulcerative colitis patients. Pain is often a common symptom that patients with IBD report. And there is an entire webinar on pain management in IBD. And so I encourage you to visit that webinar as well for more information. So very, very common condition that patients with IBD are dealing with. And pain management can be quite challenging. And there's no one-size-fits-all approach. So again, as with a lot of things with IBD, it is very individualized. So when a patient reports pain, we need to look at different things. So what is causing that pain? So we will do a physical examination. We will do blood work for inflammatory markers. So looking at what is causing that pain. Is it inflammation? Is it active disease? Or is it something else? And so blood work is commonly done, a physical examination is commonly done, as well as imaging studies. So can be things like colonoscopy, can be things like MRI or CT scan or ultrasound of the bowel. So that's really to investigate, is there inflammation in the bowel? So if the disease is active, if there's active inflammation, options from providers can be to increase the dosage of medication or change the medication or add another medication to the therapy to help decrease that inflammation. In individuals who have Crohn's disease, we recommend that if you do smoke, that you stop smoking because it can cause further pain and inflammation if you do smoke with Crohn's disease. So if there's active inflammation, so an intestinal source of pain, after we've escalated therapy, we might also include things like over-the-counter pain medications like acetaminophen or Tylenol, NSAIDs. Now, NSAIDs are to be used cautiously because for some individuals who have IBD, NSAIDs can actually cause increased inflammation and symptoms, GI symptoms in some patients. So NSAIDs are ibuprofen, Aleve, things like that. So just use those cautiously. One of the other medication management options for patients who do have intestinal sources of pain are opioids or opiates. And so those are the morphine, the Dilaudid, the fentanyl, but of course we use those quite sparingly because long-term opioid use is not recommended or proven to be effective in long-term pain management for IBD patients. If pain management is quite severe, we will consider consulting a pain service. So they are the experts in pain management, and they might suggest alternatives as well for pain. If the disease is active, but it's for extraintestinal sources of pain. So pain can come from outside of the intestine. So for example, arthritis is common in patients who have IBD. So if you're having arthritic type of pain, you might need some analgesic as well. So things like Tylenol, potentially some NSAIDs, but use cautiously. So looking at those types of pain management options if there's pain outside of the intestines. Now, if your healthcare provider does some further investigation and there's no active inflammation in the body, so then they'll look at other sources of pain. So for some individuals, they might have adhesions. So an adhesion is a band of tissue that forms after surgery, so that, scar tissue essentially that prevents the organs from moving freely. So this can cause the intestine to twist or move out of place. And sometimes when this happens, food or waste cannot pass. And so a surgery may be required. Another type of source of pain is a stricture. So a stricture is a narrowing of the digestive tract. So it can be from scar tissue as well. So if there is a narrowing, they can open it up through balloon dilatation. So that's a kind of a non-surgical or less invasive way to do that. They can do surgery such as a stricturoplasty, so open up that narrowing surgically, or remove that narrowing with a bowel resection, so cut out that area of narrowed tissue and narrowed intestine. Now, if it is not neither of those, it might be a functional pain problem. So functional GI disorders are problems that occur with nerves or muscles in any portion of the GI tract. And so what happens is that the digestive system or your intestines do not function in a coordinated fashion. And so that can cause pain. A common example is irritable bowel syndrome, or IBS, irritable bowel syndrome. So that's characterized by abdominal discomfort and pain and change in bowel habits, so alternating diarrhea and constipation. So it's not related to inflammation, it's related to the muscles and nerves not working in a coordinated manner. So how can we address that? We can encourage regular exercise. It helps to move the bowels in a coordinated fashion, physical therapy, and even psychotherapy. We know that there is a mind-gut connection, and so psychotherapy from a psychologist, it can be quite helpful. And even from a psychiatrist, some antidepressants may help with that mind-gut connection and help with those symptoms. In terms of non-drug approaches to pain management, there are lots of options. So certainly, as we've mentioned, and it's a bit duplicative from the slide before, but exercise, great way to decrease pain levels by releasing those endorphins that happen with exercise. We can also look at reducing stress levels. So through meditation, mindfulness, yoga, relaxation techniques, all can help with reducing pain. There are other psychological interventions that can be included in your management of IBD, and particularly pain management. These have been shown through research to have really good promise to help. So you will need a referral to a psychologist or potentially even a psychiatrist, but things like cognitive behavioral therapy, diaphragmatic breathing, hypnotherapy, mindfulness, guided imagery. These are all strategies and approaches that have been proven to help decrease pain levels, but will be needed to be help, guided using a psychologist or a psychiatrist. Some emerging therapies or kind of hot topics that we think are worth mentioning. The first one is medical cannabis. And the results at the moment are inconclusive as to whether cannabis can assist with decreasing inflammation in inflammatory bowel disease. However, it is known that cannabis can assist with stimulating appetite, promoting sleep, and relieving pain. So if you're interested in learning more about medical cannabis and IBD, do follow the link or visit the Crohn's and Colitis website. There is another emerging therapy called fecal matter transplantation. And so this is really related to the microbiome that we've talked about previously. So the microbiome is a collection of microorganisms that live in your intestinal system that help promote digestion and decrease inflammation. And so in individuals who have IBD, that microbiome is altered. And so if we use donor stool or feces from a healthy individual, and we donate it to a person who has IBD, we can alter that microbiome and symptoms can be better. So they are doing research trials on how this will work and whether it works, so stay tuned for that. And finally, stem cell therapies. Stem cells are amazing cells that develop into specific cells. And so the hope is that with these stem cells, they can repair some of the damage caused by inflammation and reset that immune system. And so there's great potential there as well. So if you're interested in any of those, please visit the Crohn's and Colitis Canada website to learn more. That is the end of session 4, the surgical and non-surgical management options. Please feel free to visit the other sessions as well.